Great, so welcome back everybody. I hope everybody had a comfortable sort of a break. So we've already had some questions coming in, so please do keep them coming in the sort of a chat. If I can just find my crib sheet here, I'll start sort of the questions. But before we do that, Neil, just in the sort of a break, was sort of saying about the message he really wanted to get across to everybody. So can I ask you to get that message to
I think, thank you, Mark. I think the bottom line is children have not been affected with COVID-19, unlike adults. And we have also got some clear guidance from the Royal College of Pediatrics and Childhood that the majority of children, I say majority, 99 out of 100 children can safely go back to school. So even with children who have, say, for example, asthma, who have cystic fibrosis, or primary ciliary dyskinesia, or who might also have some kidney disease as well, can still safely go back to school. A very, very, very tiny minority should be shielding, and those are the ones who have been on long-term oxygen, for that matter, or awaiting lung transplant, and that's few and far between. So the majority of children can safely go back to school.
Okay, thank you very much, Neil. So that's very much, you're hearing it. Royal College of Physicians are saying children should be going back to school. I think there is a question that we have for the sort of the school community, which is there anything that we can do at our end to help you get that messaging across? So please do let us know. So thank you very much for that, Neil. So there are a series of questions which have come in. Thanks very much to Duncan, who's been busy answering some of them in the sort of a chat, but I will put them to you anyway, sort of a Duncan. So one of the questions is around whether disposable masks should be used.
I think you can, I mean, my sort of immediate reaction to that would be, I think using some disposable masks don't offer you a huge amount of protection. I think you need to get kids into the habit of wearing, if they're going to have a mask, is to wear it and then wash it regularly. So they're sort of tight, as long as it's breathable, tightly woven, minimum 3 layers, using a material mask is acceptable, and also using a disposable one, but you just need to reinforce it. You can't wear a disposable mask for weeks on end. And if you need to dispose it, that needs to be along sort of proper infection prevention control procedures for safe disposal within schools. So you use either. I would have thought and I think the youth services have just ordered thousands of masks for children that they want to wear. So I think you just need to get them into the habits of sort of not touching them with their hands. So because that adds a potential risk, and also regular washing as well.
The other issue, just from experience in the hospital where we've had enforced masks for the last few weeks, is that you start getting, start having problems with disposal. And as I look out the window, I can see the winds sweeping up lots of discarded masks. So which are probably, aren't particularly hygienic either. So there is something about reusable masks.
Good.
Washing them properly.
Absolutely. Okay, thank you, panel. Other question, again, I think to perhaps all the panel, this one's about the measures to mitigate risk to staff who work across bubbles. And the particular example was cover staff. So should there be extra sort of care given to those sort of staff? What can be done to mitigate the risks for those staff who can't just sort of maintain just a single social bubble? John?
Duncan, I think.
I think with this one, and we were talking about this one this morning with the unions, is that there's all sorts of different professional groups that may need to come into the school. Supply teachers, people sort of peripatetic and so on. I think you just have to treat these situations like you would do in any workplace in terms of trying to make sure, if you can, that there's a minimum crossover between different bubbles within your school. And if that's not possible, you just have to be really, really hot on the infection control again, in terms of hand washing and so on, and making sure that when anybody that comes into your school, they're really aware of what your expectations are in terms of not increasing the risk of spreading coronavirus. But I think in the same sense that we want to get children education going back again, it's impossible in secondary schools to deliver the curriculum without some of this with extra people coming into the school. So I think you just have to accept that, but make sure that there's almost a sort of policy and an expectation that anybody who comes into the school signs up with, because I don't think you can avoid that. There was another similar question about, I think about sort of should you be thinking about groups of above 30 for training issues and things like that. And I think, again, in terms of the government guidance, they're fairly clear on this, is that it's much easier to keep bubbles below 30 in early years and primary schools, but it's going to be impossible to deliver the curriculum whilst doing that in secondary schools. And you're going to need to form bubbles of the whole year, which are going to be far bigger than 30. So I think the message would be to sort of try and keep gatherings of more than 30 down to an absolute minimum. But if you can't do that, you've really got to reinforce that 2-metre distance and social distancing. Another question was, well, is it 1 metre or is it 2 metres? So this 1 metre plus message that came out a few weeks ago is also a little bit confusing. The way I understand it, we're sticking to 2 metres on everything. You can't do 2 metres. The 1 metre plus is about people not facing each other. It's about, at least if people are going to be within 2 metres, they're facing in different directions and so on. So then all they're wearing masks, so you're not breathing into each other's personal space. But we've got to try and enforce 2 metres if that's possible.
On that same question, I think, Duncan, there was something about whether to divide up staff. Is that a good idea, would you say?
Well, I think that's what we would hope that schools would be doing as much as they can anyway. In terms of, and I know it's extremely difficult in secondary schools where you're teaching multiple subjects. I think you've just got to sort of try and follow the guidance as much as you can and expect that there will be situations where you have got staff that are crossing multiple bubbles, but just to try and keep that to a minimum.
So we've got a really interesting question here, which is about what about providing pre-opening training? And actually, I think, Sasha, I might actually bring you into this one, because I'm just wondering if there's sort of a bit of sort of training that can be given around, supporting sort of children's social and emotional needs. Can I ask you to talk about that?
Yes, absolutely. I think one of the things that we've been looking at is and this came on the back of the last conversation that we had with you here, was about the support that we can provide teachers and what support that looks like, both in terms of their own social, emotional, and mental health. Because then if they are themselves feeling confident, feeling safe, and feeling emotionally well, that they're more likely to pass on and share positive social, emotional, mental health messages to the children that they're working with. So we are looking at the support that we provide through our mental health support teams to staff groups, but also looking at how we work together with yourselves to think about what could that look like additionally over and above what we have in place at the moment.
Brilliant. Okay, thank you, Sasha. Duncan, any thoughts about the training that could be provided before the sort of schools open up, staff training?
No, I think we're looking into that for educational psychology, and that, again, I think that might be something that we only actually got something from the government about sort of 10 days on that. So, it's a great offer, but again, it's like it's given us 2 or 3 weeks to try and get this sorted before the start of term. So I think we'll sort of try and roll that out with Sasha and colleagues as soon as possible, but it might take us a few weeks to get that off the ground.
Okay, great. I'll just check with Neil and John whether they have any sort of thoughts about sort of our training, but then I might just ask the sort of school community whether they have any sort of thoughts that they might want to share with a sort of a wider sort of a group about things that could and potentially should sort of happen in preparation. Neil, John, any thoughts about that?
I mean, can I just clarify what you mean by trainings? Was there anything specific that one was considering?
The question is about preschool training, but I guess the idea is that, just before staff come back to sort of school, is there some training, is there some support that can be given to the sort of teachers, to the sort of staff, so that everybody, is ready to go?
I see. So I wonder if some of our IPC, Duncan, I wonder if there's some work that we can share across our infection control, infection prevention and control teams in the NHS that might be helpful here in the short term. Would that be useful?
Yeah, that's helpful, because we're coming up with new, or we're having sort of new situations thrown at us almost on a daily basis that we've never thought through before. So, the aerosol generating procedures in the school, wearing PPE, the meeting I was on this morning, it was almost as if we had a ready-made blueprint for that and a solution, and we just don't. A lot of these things we're trying to work out and resolve as we move through a changing environment. So we need examples from the medical community, and that would be really helpful, John.
Okay, let me pick that up and see if we can find volunteers for that. And just to re-emphasize Duncan's point, there is so much uncertainty and one of the big areas, for the big areas of science and research is to try and understand what happens over the next few months. Because we just don't know. We don't know about spread within schools, spread between schools and community. And we're using common sense and what we've learned from the pandemic so far in terms of our guidance. But while we crave certainty and sort of black and whiteness in what we want to do, actually, we're going to have to live with the uncertainty over the next few weeks and months.
I think one other comment, if I may, is about if any child develops new symptoms, I think it's important that they get tested, because now we know that they can be tested as well. So it's worthwhile at least pointing out that they can be tested. Unlike in the past, which would take a longer time, the turnaround times are much more quicker than it has been in the past. Okay.
General comment from me is just picking up on John's point about the uncertainty, the difficulty here. I would say to everybody, let's all be kind to ourselves. It is sort of like, what can we do? We can only do the best we can. The very fact that people are on this call, the very fact that we're working together to try and do our best, we can't do more than that. So let's give ourselves a sort of a break and try and just sort of support each other. We can only do our best, and everybody is doing their very best. One thing that occurred to me about that sort of training, I do wonder whether this could be a piece of work that the opportunity area could sort of lead, so we could hook you in. I know Daniel's on this sort of a call. So I'll have a word with the DFE team and sort of see whether we can collate some best practice, great ideas that different schools are doing, and then share that across the whole sort of school community. And we can hook in some of the ideas that have been developed by the health sort of services over this sort of a period of time. So I'll take that sort of forward as an action point after this, see if we can use the opportunity area to collate some good experiences, some good ideas, and then share those just in case there is something which might be generally useful to the wider sort of a group. Okay, brilliant. Fantastic. Thanks, John, from the opportunity area, saying that the opportunity area are going to drive that sort of forward. Okay, so next question is around access to testing. And will the schools be provided with testing kits? Perhaps, Duncan, you can start us off on that.
I think that's being discussed at the moment nationally, isn't it? I haven't heard anything more about a supply of free testing kits going to schools. I'll find out about that. But the testing would be, we've tried to clarify with the education team this week, because which staff within school are classified as key workers. There's been some confusion around this as well. And again, that's something that it's up to the head's discretion. We're not excluding any particular members of staff. It shouldn't be just teachers or just TAs. It should be any staff that are having that close contact with children should be eligible for a test. And that's the position that we're taking on that.
Good. Thanks, Sir Duncan. And again, a reminder to everybody that we're hoping that the funding will come through to Bradford that would allow us to do some sort of testing as part of this larger scientific sort of a piece of work. And I think, John, the idea would be to try and do some, try and get that sort of embedded in the curriculum as well, use it as a learning sort of a process, hopefully use it as, as a positive educational experience for the children. Is that right?
Yeah, so we're close to pulling this off, and it would be quite large-scale testing across quite a number of schools if we do it. It's very much for trying to understand what happens in the next 6 months in the second wave. But I think one of the principles of what we're trying to do in all the work that we're doing in Bradford is to engage communities in our research, but children and young people in particular for this incident. One of the interesting things about the pandemic is how it sparked interest in science, and people understand what our numbers are, and discussions about vaccine, and following the coronavirus counts across the world like league tables. So So we can tap into that scientific curiosity for our children and young people. Would love to support it. So yeah, let's try and build on that.
Brilliant. Thank you, John. And there's a lot
on the test. Sorry, on the testing, just to sort of finish off on that, because there's a few people that have helpfully put stuff in the chat. So there's a few people that have said that there is a small supply. I think it's 10 tests that are going to be sent to all schools as well. So you will get those. But the other options for key workers is that you can request tests sent to your home through the national testing lines and so on. You can get through that. And then the local testing centres in Marley Fields, which is Airedale end of the patch, which might not be convenient, but you can book a testing and go there as well. But I think one point to make clear is that testing capacity isn't infinite. So, you know, for head teachers, you need to be really thinking about which staff should be getting tested regularly, but also thinking about, you know, there might be pressures from admin staff, cleaners and so on to do that as well. And I don't think that's really justified. We really need to protect our testing capacity for the people that really need it.
Thank you. Actually, can we just sort of pick up on sort of something which I think sort of occurred sort of multiple sort of times, and that's there's lots of chat about sort of office staff, but also kitchen sort of staff. So what's the sort of guidance around, let's say, kitchen sort of staff? Should they be wearing masks the whole time, doing sort of 2 metre distancing, so on and so forth?
Well, I think that would apply to any other setting, any other work setting. We've seen really large outbreaks in textile factories, food processing plants, and so on, by people working in really close proximity and not observing those distancing. So I think it's one of those things you'll need to discuss it with your own staff. But if you've got kitchen staff that can't work in that way, again, that they would come under, for me, the same sort of guidelines as that we're applying to all other staff in the school. If you can't keep that social distancing down, you should be trying to wear masks. I mean, another question that came in is about why is all the guidance about secondary schools and not primary schools? So sort of just to make that clear, I wasn't sort of trying to recommend not wearing masks in primary schools. It's just that the point with secondary schools is that we've got larger numbers, and we've got an environment where staff and children are wearing face coverings in busy social areas. That's very different to staff wearing them and children not in primary schools. But again, this is at head teacher's discretion. If you think you've got an environment where you cannot maintain social distancing within primary school environment, it's not going to upset children having teachers with masks on the whole time. That's up to you. You've now got the discretion to be able to apply those face covering rules in those environments as well.
Thanks, Duncan. And for clarity, so there was a question about, is everything that's being sort of said at this moment in time going to change as and when the additional restrictions get lifted within the Bradford district? Or is this just advice that we should adhere to regardless?
I think this is advice that you should adhere to unless you hear otherwise. I don't like trying to make policy on the hoof for Bradford district, because we need to discuss it with other people, and we only had, like, within the last 24 hours, a U-turn from the government. So I think just follow what we've had at the moment. We're reviewing it on a week-by-week basis. The infection rates within Bradford are falling slowly, but we're going into winter and we're still one of the highest rates in the country. So I think these measures around face covering are sensible for the foreseeable future, and we'll let you know if there's a change in the position.
Another question that we've had is relating to the use of school nurses and whether school nurses can play a role, or what role they should play. I think Sasha's probably got some thoughts with regard to that in terms of her CAMS referrals and the like. So I might ask Sasha if she can speak a little bit about her thoughts around school nurses and the role they can play in helping the whole system survive the return to school.
Absolutely. So I think there's something about the information and understanding that we have about, as I mentioned earlier, the issues that children and young people are likely to speak about, and being aware of those issues and how we respond to them. I think how we're looking to work with school nurses who traditionally in Bradford for the past 17 years, school nurses have been the only route and the majority, the only route to refer into specialist CAMS. And with the changes in school nursing and in the 0 to 19 pathway that we have, we've been really looking at working together with the integrated front door that we have, in terms of providing support and looking at that early help, building resilience, building support for children and young people, and how we support that element of working. I think school nurses, there's one opportunity that we have is looking at, we know that the number of school nurses we have is really small, is looking at some partnership working with the opportunity area to look at how we can maybe increase that capacity. But really working in terms of how we are getting the integrated one front door to work, and the new mental health pathway to work has been around how do we make sure that you have the easiest way to get advice and support, or if need be to refer into services. So because there's a lot that children can do within schools, and how we build that support environment within the school, so that the school nurse probably is somebody who will look at issues around self-harm and looking at issues around looking at what role the school nurse can play, and what role we can have pastors and the mental health school champions and the youth apprentices and the mental health support team, how those different roles work within your school to provide that supportive environment, both for children but also for the staff as well. And I think that's where we can really look at working with school nurses to identify what that support looks like and what their role is within that wider pathway, so that it's not all, as it has been in the previous years, it's not all on the school nurse to do everything. And what the approach had been previously is that we were wrapping support around the school nurse to be able to do that, when actually what we're looking now to move to is what support can we wrap around the children to make sure that the children that need a school nurse can see a school nurse, but those who can see other professionals can see those other professionals.
Thank you. And John's going to speak.
Yeah, I presume they're going to be fairly busy over the next couple of months with flu vaccinations for years 7, 8, 9, is it, that they're going to be doing. So that's such an important part of containment over the winter and the second surge. Just I know we're all focused on the acute bit at the moment, but one of the key lessons from the adverse effects of COVID-19 is around obesity. And all the work from boarding practice shows that it starts in early life and childhood. And one of the things we've got to try and think about over the next months, going in the longer term, is how we help our children become more physically active and have better diet, and that will help reduce the harm of this virus and other diseases later on.
Yeah, and perhaps this is the time to sort of plug the great work that Jump Us sort of are doing, who will be trying to sort of work with the sort of schools across the sort of a district to help children be more active. And all of that information will be in the sort of booklet that we're putting together, just outlining the resources and trying to give a holistic sort of viewpoint of evidence-based approaches to take care of the needs of the sort of whole sort of our child. Just picking up a point that Sasha said, I mean, the school nurses led by Michelle Smith, really keen to become more and more involved and support schools. We have 12 school nurses across the whole sort of the district, so that's something that clearly we need to sort of think about and sort of tackle. They have been overshadowed by health sort of visitors, I think, but I think we all believe they've got a real role to play. So we're working closely with Michelle and that sort of a team to see what support can be wrapped around that whole sort of the school system to try and do the very best by sort of children and young people in terms of every aspect of their life. Any thoughts on school nurses and the role they can play, or the health sort of system more generally within schools?
They very much can play an important role, but as you mentioned, they pulled in a number of directions itself. But they are very useful health professional, if you wish, in terms of giving guidance. No doubt about it.
One of our goals, longer term, also is. We've shown how linked our data is very fragmented across health and social care and education, is to try and connect that up. And one of the lessons under national legislation has been to move to better sharing of data it's called COPI, during the pandemic. one of the things we'd like to do is to continue that. And so, for example, link NHS and UPN numbers so that we have clearer understanding about clusters, how and information sharing, not just for infections, but also for child welfare as well in the long term. So let's watch this space.
Yeah, and maybe this is a good time to sort of advertise a piece of work that we've been asked to lead by sort of central sort of government, which is seeing how we can actually make all of the rich sort of data sets that describe every aspect of a child's sort of life available to everybody with safeguarding sort of duties and responsibilities for children. So people like sort of Anil sit up here seeing sort of vulnerable sort of children, and they have to make safeguarding decisions on the basis of very fragmented and very partial information. And effectively it's asking Anil or our other paediatricians to make very, very difficult sort of decisions with frankly two hands tied behind their sort of back. So what we're looking at is how we can bring together all the sort of data sort of sets in a way that allows everybody from a school system or as anybody with safeguarding sort of duties in social sort of care, in the health service, in the school sort of system, to start understanding every aspect of a sort of child's sort of life. And then helping all the different services work together more effectively. So Bradford is at the forefront of that work. We're hoping that the benefits of that work will be seen in Bradford before they start being rolled out in any other part of the sort of country. So there is good sort of stuff happening. This stuff takes a long time, but it's only by working together we're going to get those long-term changes that we know we all need, not just to cope with sort of COVID, but to cope with all of the other problems, such as the problems around non-communicable diseases that are so well protected when we start driving down our obesity rates and the like. Okay, any other points on that? Good. Okay, so I think we're starting to come to the end of the sort of questions that we have. Again, for the point of absolute sort of clarity, Duncan, just because this question has come up in so many different forms, face coverings for primary sort of staff, can we kind of get the definitive sort of a view on that?
I mean, it's similar to what I said before. Perhaps I'm still getting other sources of information coming in on this. As I said, we've only had a day to think about this, and we'll issue a statement very quickly. But my advice on this would be for head teachers to look at their staff and the environment that they've got with young children, and first of all say, can they not maintain social distancing, and if not, do they want teachers walking around with masks on with primary school children that won't be wearing masks? Staff that are vulnerable, have got clinical vulnerabilities, as I've said, I think that's really sensible to do that. And if they feel that their environment is an environment where there's a risk of transmission, they should implement those measures so that staff can wear that. But I think it's up to head discretion. There isn't any national edict on that at the moment, so we'd need to make a position on that in Bradford, and that would be my advice to make that decision based on what they think the risks are in their school and what they've heard. It's as I said before, the evidence isn't huge, and the things that are really going to keep infection down are regular hand washing, social distancing. Face masks are an additional plank in our interventions, but they're not the only one.
That's so useful. Thank you so much, Duncan. So we've got 5 minutes left. So if anybody's got any last burning question, please do put it in the sort of chat. Otherwise, what I'm going to do is do what we did at the end of the last sort of webinar, and just go around our panel and just ask each panel member for just one nugget of advice or one thought that they can sort of impart to the sort of school community as we return. So I guess what we'll sort of do is perhaps just go through that in the same order that people introduce themselves. I'll start off with sort of John, then I'll ask Anil, then I'll ask Duncan, then I'll ask sort of Sasha. So to say, last opportunity for anybody to put a question in the sort of chat before I go around our panel in the order I've just described. And again, just to reiterate, we will be in contact. All the materials from today, any questions, we'll collate all of that. We will make it available. We are putting together this booklet, which will hopefully be a really useful resource. And I do want to make the point that booklet is just the starting point of a conversation. This is us saying, we think this is information that might be useful to you within the school community. What we'd love then is for you to feed back and say, do you know what, we really want to know what the evidence is around this. We really want you to start addressing these sort of questions so we can get that sort of a two-way dialogue. It's the only way we're going to crack the sort of a nut of improving physical health, mental health, education attainment, and social mobility for all the children and young people in this sort of a district. So we will be sending all of that out. I will now just go around the sort of a panel for that last sort of nugget of advice. No more sort of questions have appeared. So John, what's your last nugget of advice, your last sort of a thought for our community?
I think we are all united in wanting to get the children back to school. You know, this is a very simple equation. You know, there's a risk of an infection, but there's a long-term risk of the loss of education here. And we know that, you know, the educational attainment is already unequal, you know, in The Guardian yesterday, it was 1.5 years across the index of multiple deprivation. That's astonishing, really. What's happened during lockdown is going to make that worse. So let's try and do this. Everybody's nervous. We've experienced it in the health service over the last few months. People who have been working from home have gradually started coming back, and there is a bit of just, you know, letting it happen and reassuring people and overcoming people's fears, and people do just get back into normal. So you know, be reassured, things will be okay.
Thank you, John. Anil?
For me, children have not been affected as much as adults. Children have been very, very, very minimal symptoms, and that has shown up even on our attendance to the hospital. And even currently, for example, we have had very few children who have been affected from the COVID-19 infection per se. So in our view, and also based on evidence, they can safely go back to school, is what I would say.
Thank you, Anil. Jeb, so, you know, so the message from all the health authorities, it's safe to go back to school. Again, if there's anything we can do to help you with that messaging, let us know. Anything we can do at all to help, let us sort of know. Duncan, your last piece of advice?
I think for me, I think what we've learned is that we need to keep up good and clear communications in settings. And we're finding that people are starting to get, you know, they're getting bored of coronavirus. People are starting to sort of think of reasons why it doesn't apply to them and so on. So I think once term goes back, it's just to stick to those key messages that will send you, you know, around the way that you move children and people in and out of schools within social distancing, regular hand washing, and keep those messages applied, and try and take a sort of behavioural approach, which I said we're going to try and develop with the young ambassadors, on why it's important for them, what's in it for them as well. Because as Anil said, that there's very little risk in terms of poor health for children around this, but there's huge risk for society. So I think we have to try and keep that with those sorts of key messages on everybody's lips within schools, really.
Thank you, Duncan. And Sasha, over to you.
So I think my key message would be, one is something I think you said earlier, don't be hard on yourself, and recognise that this is something everyone's been through, so both staff and children. And the impact on children probably is something that, in terms of their social and emotional health, we will start to see what the impact has been over the next few months. It might not even be something that we've seen now, and we'll learn more. So that channel of communication is really important for us to keep open, so that we're sharing what we're seeing, what's going on, so that we can build and learn how to work together on that. But you know, key message is to know that there's support available and to keep communicating.
What a brilliant note to end on. We're all in this together. We're a community. We're going to work together to get through these sort of difficult sort of times. So we are actually on that very sort of a topic. In sort of 5 minutes' time, we're going to join with our colleagues across in sort of California, and we're going to be hearing from a panel of experts again, who will just be telling us about their sort of research and sort of evidence that they have been putting together. So this really is a sort of team effort, not just even within sort of West Yorkshire, not just within sort of a Bradford, but really sort of internationally. And let's sort of stay sort of focused on that. There's lots of good sort of things happening, lots of sort of great people across the sort of system. working together, we will beat this. So thank you so much to everybody for sort of joining in. Thank you ever so much to everybody for their contributions. Massive thank you to sort of our panel. We will be in touch. We will be making all these materials sort of available. Until then, please stay safe and do let us know if there's anything we can do to help. So we will say goodbye and perhaps see some people on a transatlantic call in 3 minutes. Okay, thank you everybody. Bye-bye.